Hello, my name is Stephanie Townsend Ayala. I'm an elder law and estate planning attorney here in El Paso and the proud video host for the El Paso Eldercare channel. Today we're speaking with Patricia Nares of Sun City Home Care Inc. Welcome, Ms. Nares. Thank you for joining us here today.
Thank you, Stephanie. I'm very happy to be here and to share some information with you and the people that you work with regarding elder care and how best to deal with our elder population here in El Paso.
Well, you're hands-on in that area. You provide services for many citizens around the community and help them stay in their home. Tell me, when you're helping people stay in their home while they're suffering from catastrophic illness, what are some of the biggest problems that they encounter in trying to get your services in place?
Well, the home care benefit under Medicare is covered 100%. So when you go to a licensed agency such as Sun City Home Care, who has been working in the community for 25 years under the same administration, we're very proud of that fact because it's hard. The home care market is very competitive. And we like to think that we provide a full service for our patients when they go home. A physician, of course, has to order the home care. And because of the constraints of the Medicare program now, we are very limited as to the diagnosis and the homebound status of our patients.
What does that, can you explain that term, homebound status and diagnosis? How does that affect whether or not they can get Medicare to cover it?
Well, that affects it in a very large way. First of all, the patient has to be homebound in order for home care to be provided. And by homebound, it used to be a very loose term, but now Medicare is really being careful about scrutinizing the homebound status of the patients that are receiving home care. So a patient has to be homebound. That means that they cannot leave their home under their own power. They cannot, they can't drive. Even if it's short trips, they have to be homebound. They have to require the assistance of another person or an assistive device such as a walker, cane, wheelchair, Hoyer lift, something of this sort in order to get out of their home. Once home care is approved and the agency goes in, then a complete assessment is performed. And a registered nurse goes out and assesses the patient and the home environment because the home environment has to be safe. And if
so, what you're talking about is when they're preparing to get out of the hospital first. Okay.
So when they're preparing to get out of the hospital, the physician is the one that orders the home care.
Correct.
He says, I have this patient, she's had a hip replacement.
And then how long will Medicare pay for home health care?
Medicare will pay for home health in 60-day intervals. So once the doctor discharges the patient and we go to the home and the nurse makes the assessment and says the patient requires assistance with bathing, with ambulating, we need to get a physical therapist out here to do exercises and strengthening. She does a home assessment and makes sure that there are appropriate equipment, assistive equipment like a bath chair or bath rails or a ramp to get wheelchairs in and out of the home. Once this is determined and we get everything together, we send a plan of treatment to the physician and he signs off on it and says, okay, yes, I do want you to do these things. Okay. I want you to provide physical therapy. I want you to help them bathe. They need this equipment. I'll sign the orders for the equipment.
And Medicare will pay for the equipment to come into the house?
And equipment is paid separately from home care. So depending on the equipment, Medicare does not cover all durable medical equipment. For example, they don't cover bath benches. One of the most common things that is required, that is necessary for a person to be safe in their home and safely get in and out of their tub or in and out of their shower, is one of the things that's not covered.
Oh my goodness, that's so interesting. Now tell me something. When a lot of people think that they're doing a really smart thing by buying added insurance other than Medicare, and then they're in a shocking surprise to learn that getting out of straight Medicare was actually worse than having nothing at all.
Unfortunately, when they added the Part D to Medicare. That turned loose, open floodgates for insurance companies to offer not just Part D, but also Medicare,
Alternatives.
well, yeah, Medicare plans that tie the patient into like an HMO or a PPO.
Which is something that I never recommend an HMO for an elderly person. That always causes trouble. Every one of my clients who is in an HMO who is elderly has difficulty with it when they need help the most.
Unfortunately, they do make it more difficult because most of the HMOs and PPOs are run by insurance companies that are going to require prior authorization, referrals. A lot of times the doctors don't participate in the plans, and so they have to change physicians. And this is very disruptive, especially to an elderly person, because they
Right.
establish a relationship with that physician and the people in their office, and they depend on these people.
And the reason that doctors don't participate, it isn't the money, it's the paperwork. It's just an overwhelming mountain of reporting on a daily, weekly basis.
Yes, and unfortunately, when they have some of these PPOs and HMOs, when they go to home care, whereas if they had Medicare and they were in the hospital, the doctor says, I want to send you home with a physical therapist and maybe a home health aide to help you to bathe and get you safe, you know, teach you safe methods to live in your home. And all he has to do is order it, and the patient elects an agency. They have a choice.
Mhm.
The hospital should give them a list of agencies that are licensed and approved in the state of Texas and work with Medicare, and they can choose their agency. And with an HMO and a PPO, this is not true. The primary care physician has to first call the insurance and ask them if it's all right for him to send home care.
Mhm.
And a lot of times they say no.
That's the difficult part. And so if you're talking to people right now who are listening who are very concerned about planning and making sure that they have a plan in place, what would be your best advice in terms of ensuring that the insurance coverage you have will be there if you're hospitalized and need home health care after a hospitalization?
I would say that the best thing for you to do is to keep your traditional Medicare coverage. If you choose to buy a Medigap plan or an insurance that will cover the yearly deductibles and the
The donut
co-insurance, well, no, the donut hole, that happens with the Part D plan.
Okay.
A lot of those Part D plans, you max out your pharmaceuticals at a certain dollar amount, and then
And
you
you're
fall
stuck.
into that hole. And usually you fall into that hole right around the end of the year.
I know, isn't that scary? Wow. So anyway, you were saying.
So really the best thing for them, this is what I tell my mother and my aunts and everybody, keep your traditional Medicare. If you want a Medigap policy, you can get an inexpensive Medigap policy that will cover your 20% copay and your deductible, and you'll be good, and get your Part D plan that covers your medicines. Make sure that your medication is on that Part D coverage list, and you'll be set. You won't have any problems. You'll have lower out-of-pocket. You'll have much less paperwork for your physician, for your family, and for yourself.
Excellent advice. And we are talking today with Patricia Nares of Sun City Home Care. I'm Stephanie Townsend Ayala with the El Paso Eldercare Channel, and we'll be right back.